Hello, my name is Suhani, and I will be covering Chapter 69's Objective 1. Objective 1 will be covering infectious disorders of the nervous system according to causes, manifestations, medical care, and nursing management. The first infectious disorder that I'll be going over is meningitis. Meningitis is the inflammation of the meninges, which cover and protect the brain and spinal cord. The three main causes of meningitis are bacterial, viral, and fungal infections, and that can be found on page 2065. Manifestations of meningitis. The initial symptoms are headache and fever. Fever tends to remain high throughout the course of the illness and can result in meningeal irritation. Other manifestations include changes in level of consciousness, behavioral changes, stiff neck, positive Koenig sign, which is when the patient is lying with a flat thigh flexed on the abdomen. The leg cannot be completely extended. When Koenig sign is bilateral, meningeal irritation is suspected. Positive Brudzinski sign, I don't know if I said that right. That is also a manifestation of meningitis, and that is when the patient's neck is flexed and flexion of the knees and hips is produced. When the lower extremity of one side is passively flexed, a similar movement is seen in the opposite extremity. Brudzinski sign is a more sensitive indicator of meningeal irritation than the Koenig sign. And lastly, photophobia is also a manifestation of meningitis. And all those can be found on page 2066. And you could refer to figure 69.1 for both of the signs. It shows pictures of it. The medical care. Successful outcomes depend on early administration of an antibiotic agent that crosses the blood-brain barrier into the subarachnoid space in sufficient concentration to halt the multiplication of the bacteria. Penicillin G is given in combination with cephalosporins, is most often administered intravenously, optimally within 30 minutes of hospital arrival. Prevention by meningococcal vaccine to youth 11 to 12 years of age, and then a booster is given at 16 years of age. The first year college students and members of the military are vaccinated. Dexamethasone has been shown to be beneficial as an adjunct therapy in the treatment of acute bacterial meningitis and in pneumococcal meningitis if it is given 15 to 20 minutes before the first dose of antibiotic and every 6 hours for the next 4 days. Treatment for dehydration, shock, and seizures are also medical care, and that is found on page 2067. Nursing management is found on page 2068, and nursing management includes initiating infection control precautions until 24 hours after initiation of antibiotic therapy, and assisting with pain management due to overall body aches and neck pain, assisting with getting rest in a quiet, darkened room, implementing interventions to treat the elevated temperature such as antipyretic agents and cooling blankets, encouraging the patient to stay hydrated either orally or peripherally, ensuring close neurological monitoring, monitor daily weights, serum electrolytes, urine volume, specific gravity, and osmolality, and lastly, protect patient from injury related to seizure activity or altered level of consciousness. The next disease or infectious disease is brain abscess. Brain abscess is a collection of infectious material with brain tissue within the brain tissue. And a cause of brain abscess is bacteria. So bacteria are the most common causative agent, like organisms of brain abscess. Manifestations may include headache that is usually worse in the morning, fever, vomiting, neurological deficits, signs and symptoms of increased cranial pressure. And all that is found on page 2068. Medical care includes treatment that is aimed to controlling increased ICP, draining the abscess, and providing antimicrobial therapy directed at the abscess and the main source of infection. That medical care is found on page 2069. Nursing management includes frequent ongoing neurological assessment, administer medications, assess response to treatment, and provide supportive care. And that's also found on page 2069. The next disease we're going to go over is encephalitis, which is an acute inflammatory process of the brain tissue. This is all going to be covered on page 2069. The causes of encephalitis include viral infections, which could be herpes simplex virus, vector-borne viral infections, which could include West Nile or St. Louis, and fungal infections. Manifestations include headache, fever, confusion, hallucinations. For vector-borne diseases, infections, it could be a rash, flaccid paralysis, and Parkinson-like movements. Medical care include acyclovir for herpes simplex virus infection, amphotericin or any antifungal agents for fungal infections. Nursing management includes frequent and ongoing assessment, supportive care, comfort measures to reduce headaches, which you can implement, like dimming the lights, limiting noise that's around the patient, and administering analgesics for pain or like headache. And I'm totally going to butcher this name, but Creutzfeldt-Jakob disease and variant Creutzfeldt-Jakob disease is a rare degenerative infectious neurological disorder caused by TSE. And that will be found on page 2071, including the cause, which is very rare and has no identifiable cause. TSEs are caused by prions, small proteinous particles that are smaller than viruses and resistant to sterilization. The disease is not spread by casual contact. VCJD may be contracted through injection of infected beef. Manifestations include affective sensory, motor, and cognitive impairment, which is found on page 2072. Medical care, there's no effective treatment. It's progressive and fatal, so the care of the patient is supportive and palliative, which is found on page 2072, including the nursing management, which is prevention of disease transmission, blood and bodily fluid precautions, and lastly, supportive and palliative care. You want to keep the patient comfortable since this is a fatal disease and there's no effective treatments. Thank you for listening to my presentation.